Go ahead now.
Good afternoon, everyone. I'm Dr. Akhila, consultant and fertility specialist, Oasis Fertility. Today, I'm going to be talking about how lifestyle affects fertility and what are the implications and what little can we do to prevent these complications that we get because of the lifestyle. So, in the recent past, a lot has changed in our lifestyle, coming to what we eat, our sleeping pattern, our work culture, our habits. Everything is very different now than what it was before. And because of all this, it has a deleterious effect not only on fertility but general health as well. So, today I am going to be covering a few topics that are important that we do on a routine day-to-day basis and how we can do it differently to improve fertility and also general health. So and some of these factors are something that we cannot modify, some are modifiable. So what we can do about the things that we cannot modify? So I'll be talking about the age, weight, intake of caffeine, alcohol, smoking, how to reduce the stress and work, exercise, certain chemicals, the diet that we should follow, and things like this. Coming to the age first. So, the age, when it increases, it has a negative effect on fertility in both males and in females. So men who are more than 40 years and women who are more than 30 years can expect fertility problems. What happens in men who are more than 40 years is the count comes down, the parameters, the motility, and the morphology also gets affected. When it comes to women, as women age, the number of eggs that decreases. Not only is the number, the quality also comes down, and they're more prone for chromosomal abnormalities with increasing age. And because of the recent change in lifestyles and career options have increased, so women who want to postpone their fertility to after 30 years of age can freeze their eggs and utilize them at a later date. Coming to consumption of junk food, we are all nowadays fond of pizzas and fries and other junk food. So the fat in these junk foods causes hormonal disruptions and therefore causes menstrual irregularities. So inculcating a healthy diet which includes healthy fruits and vegetables and whole grains is something that is going to help us. Now, coming to the weight, being underweight and overweight is not something that is healthy. So, a BMI less than 18.5 is termed to be as underweight. And what problems do we get because of being underweight is that in women they can experience preterm labors and other complications in pregnancy, and in men the sperm count can be less if they are underweight. And in the problems with overweight is that in women they can have infertility issues, that is conceiving itself is a problem, miscarriages, stillbirths. These are some of the things. Also in pregnancy they can have hypertension and other medical disorders. These are some of the problems associated with being overweight, which means that when your BMI is more than 25, obesity when your BMI is more than 30. In men, it can cause semen parameters to be abnormal, decrease in libido, erectile dysfunctions. All these are some of the things that can happen with being overweight or obese. Now, sleep. 7 to 8 hours of sleep per day is termed to be as adequate. Anything less than that over a prolonged period of time can cause hormonal disturbances, and because of which the cycles can become irregular. So this is something which is simple and easy to do. That is, get about 7 to 8 hours of sleep. Consumption of caffeine. Women who consume more than 100 milligrams of coffee per day are more at a chance of having fertility issues than the other women who consume it occasionally. Smoking, we all know that smoking is unhealthy. It contains about more than even 4,000 chemicals that are there. And smoking in men can cause a decrease in the counts, decrease in motility, and in women, not only does it cause ovarian dysfunction, that is decrease in the egg number, also quality, but it also affects the uterine function and the tubal function as well. Alcohol consumption. The alcohol consumption also is in men, it causes testicular atrophy, and again directly related to decrease in the sperm parameters. And in women also, the time to conception is increased in women who consume alcohol on a regular basis. um, there was a study that was done which said that women who are more prone to get uh, hangovers are those that have a longer time to conception, which directly implies that the quantity of alcohol has an impact on fertility. Coming to certain other things like usage of lubricant jellies during intercourse, like the KY jellies, etc. Any lubricant has a spermicidal effect, which means it can damage or kill the sperms. So usage of lubricants is not recommended if you're trying for fertility. Now, there are things called as endocrine disrupting chemicals, EDCs. So these are certain chemicals that mimic the natural hormones. Now, these chemicals are present in a lot of day-to-day products that we use, like cosmetics or plastic bottles or other plastic things, the toys that the children use, certain shampoos and lubricants. These EDCs are present in all these items that we use regularly. And so these are some things that it is better to avoid usage of all that. And cell phones also cause certain radiation. And the studies have shown that men who carry their cell phones around the waist have decreased semen parameters than those that do not carry or carry it elsewhere. Um, Now, there certain tips for a healthy diet is to include a carbohydrate-rich diet for fertility and to decrease the protein and the fat intake that is there, to inculcate a habit of eating fresh fruits, vegetables with a high fiber diet. So the ratio of monosaturated fatty acids to trans fatty acids should be higher. Also, vegetable fat is better, vegetable protein is better than animal protein, and high fat over a low fat diary is what we expect, and foods which have low glycemic index. These are some of the food items that is better to consume. And the other important simple ways of dealing a healthy life is to look for these five things that I will be telling you. When we go out to buy, read the labels. So if in the labels there are things that we cannot pronounce, so it is better we don't buy them. Also, better to go organic, which means nowadays we get substances which are organic. It is a little expensive, but better to buy these organic items. Also, remember that the farther the food travels, the more chemicals it has to preserve it. So the lesser distance the food travels, the better it is. Coming to the usage of the chemicals and other things, so it is better we use homemade chemicals for cleaning and other things than to buy the other chemicals which are there from the market outside, because they may contain these EDCs, that is endocrine disrupting chemicals. So homemade chemicals like vinegar and lemon can be mixed and used for cleaning purposes. Very important to remember is to avoid drinking water from plastic bottles, again because it contains these EDCs. Prefer to drink water from metal or glass bottles, and also usage of plastic in microwaves. We microwave. It is better to use the containers which say microwave safe than to use the other containers. These are some of the tips that we can follow to have a healthy lifestyle. Coming to exercise, about 3 hours per week is what is recommended, which has a good benefit not only in fertility but in the general health as well. And these are some of the things that I have spoken to you about, which can help improve fertility and the general health as well. Um, this is what I wanted to talk about fertility. Any fertility and lifestyle. Any questions, please? Yes, of course. A healthy lifestyle definitely improves fertility. That is one of the biggest causes of infertility that we cannot explain at times, and that's the reason improving lifestyle, improving general health, eating good food, regular exercise, all this um, has a lot of benefit, and it in fact not only helps in fertility but avoids all other medical complications as well. Okay, so how can I change my lifestyle to conceive? It all starts with what we eat and how we exercise. So I have told you about broad structure of what we can eat. That is a fertility diet, which should include more of vegetable protein, monounsaturated fatty acids, and high fat over low fat dairy, with high fiber diet rich in iron. And this is when it comes to this is about the diet. To do regular exercise about 3 hours per week, and even the work stress should be reduced. So it is shown that women who work for more than 32 hours per week are more, they have more chances of infertility than the others. So work stress should be reduced. Sleep, adequate sleep is important. That is 7 to 8 hours of sleep. And avoiding smoking, decreasing the caffeine content, decreasing alcohol consumption. All this has a benefit uh, and helps you to conceive at a faster pace. And these are some of the things that we do routinely day to day that can help us. What makes a woman most fertile? So the chances of fertility are highest when the woman is slightly younger, less than 30 years of age. So that is the first thing. And also at a weight that is appropriate, neither too thin nor too obese. Following these healthy diet tips, and these are some of the things that you know when a woman follows, it is likely that fertility chances are higher. So AMH and ovulation. More than this, a woman who has regular periods and predictive periods, that is, if you can predict that you're getting a period, these predictable cycles, regularity is something that can tell you that you are ovulating more than even AMH. AMH tells us about the number of eggs that a woman has, and the AMH also should be optimum, not too high or less. A woman with a high AMH is mostly categorized as a polycystic ovarian syndrome with many eggs, and most likely her cycles are irregular. So the best way to predict ovulation is regular cycles uh, that can be predicted, as in the woman knows that she's going to get a period, there are slight cramps or uh, discomfort, or she can predict her cycles. That is a better sign of ovulation. So this having regular periods does not really mean that you are ovulating. It only is a prediction that, you know, with the regular cycles, ovulation can be expected. But because the hormones needs to be checked, and ovulation depends upon the hormones, the LH surge that is there. So the best way to check for ovulation is through scans, or you get these ovulation kits where the LH is monitored. These are these are the two things that are more authentic. The other ways of checking ovulation is the body temperature checking, wherein during ovulation there is a slight rise in the temperature because of the increase in progesterone that is there, or the cervical mucus thickness, that, you know, there is a Barkeep sign that cervical mucus stretches during ovulation. That can be done without the medical help, that is, without the help of scans or these kits. These are the other two ways where you can check ovulation. So it is not essential that if you are having regular periods that you are 100% ovulating. It is most likely that you're ovulating, and why depends upon the hormonal imbalance.